Hey guys, one of the questions that I get a lot in clinic is if somebody comes in who just had a back surgery, they wonder if they can get back to rowing, either on a boat or on the rowing machine. The answer is yes. You had back surgery. Your back is fixed. There's nothing going wrong there. You might even have, you might have had a discectomy, you might have a fusion, whatever it is. There are things that you can do to still be on this machine or in a boat. So, in this video, I'm going to cover that. My name's Amanda Painter. I'm a physical therapist and rowing instructor. This is Roxy, my dog. Perfect timing. But I'm going to show you some of those things that you can try. One of the big things that happens is, let's say that you had discectomy, removal of one of your discs. Sometimes the reason you do get that surgery is because you might have had symptoms going down your leg. If that's the case, the nerve has been aggravated. It might have been getting aggravated up here, but either way, that nerve, the entire path that the nerve goes, comes out of your back, goes underneath your butt, and goes into different areas of your leg. Because the nerve might have gotten bugged, essentially, when we row, our nervous system actually gets stressed a lot in the positions that we are putting it in. So one of the things that you can try, if you're in a boat, it's a little bit different. You want to kind of try and keep this to a minimum unless you're in a single person boat. But if you're following people, it's a little bit more difficult. So I'd start with this as just a gentle intro kind of on the rowing machine. Start with short sets so that you're not out on the water where you're stuck rowing if your back starts to act up or your nerves start to act up, and you can control when you stop. But one of the things that you can do is get into the position, and as you go towards the back, so on your drive, instead of letting your knee straighten all the way, keep a baby bend in the knee, and it doesn't need to be drastic. So this is all the way straight, this is a baby bend. Straight, baby bend. If you keep a baby bend in the knee, it'll actually create it so that that nerve has just a tiny bit more movement and it doesn't get stressed as much. And that tiny change makes a huge difference when it comes to the nerves in your leg and coming out of your back. So that's one of the things that you can try. Just don't straighten that knee all the way, put a slight bend in it, and you can still go back. Second, really work on your form. If you're leaning all the way back like this, yeah, your back's gonna not be happy. But if you stay at that comfortable range for your layback, for your lean back, then it will be less likely to get aggravated. So that's some of the things that you can try when you're on the rowing machine or when you're in the boat to take some pressure off of the nerves. The other thing that you could try is before and after you row, give these things a shot. Like I mentioned, those areas, so your back is here, you've got the nerves, they come down the leg, but you've got muscles that are attached here and ones that go lower. So you want to do things to kind of try and relieve all the areas that attach to our back. So in order to do that, we actually start lower. Our hamstring attaches to the pelvis, which pulls on the back. So the first thing you can do is a hamstring stretch. You can do this sitting. Take one foot, put it in front of you, heel on the floor, relax your foot. Don't worry about bringing your toes up towards you. That puts more pressure on that nerve. Sit up nice and tall, gently lean forward at the hip, keep your shoulders forward, and get a nice stretch in that back of the leg. If you feel something in your calf, go ahead and put a slight bend in the knee, just like we talked about on the rowing machine. That's one of the stretches you can try. It's a stretch for your hamstring. Hold it for 30 seconds to a minute, do it 2 times, get up to 2 minutes of stretching. Do it on both legs. All of these things, do it on both legs. The other thing that you can try if you're getting some symptoms is actually for the butt muscle, your piriformis. So what you can do is, you can do this laying down, you can also do it sitting. Take your leg, cross it over like you're sitting in a figure 4. Keep your shoulders facing forward. Take your hand, grab your knee, pull up towards the opposite chest. So just like that, and just try not to rotate, keep those shoulders forward, and just pull up. You should feel this kind of around here in your butt. Sometimes you might feel this a little bit more if you do it laying down. I wouldn't really recommend it too much on this seat because you just don't usually get in that great position. But you want to get a gentle stretch with both the hamstring and this. You want it to be gentle, don't overdo it. If you overdo it and feel an intense stretch, it might actually tighten up in rebellion and actually aggravate you a little bit more. Same thing for this, 30 seconds to a minute. Try to get to 2 minutes of stretching. Make sure you do it on both sides. Next thing you do is for those muscles up on the top, actually in your back. And you can do this lying on the ground. Take one leg and keep one straight, or do this with both legs, and you're gonna pull up towards you to try and get a stretch kind of through any of that area in the back. You might feel it more with one leg, you might feel it more with two legs up. Figure out what's comfortable for you. We call that a knee to chest exercise stretch. Same thing, try that for a minute, get up to 2 minutes, do it 30 seconds. Try not to round your back while you're doing it. So, quick recap, things you can do if you're getting some discomfort or if you're getting back to rowing after you had some back surgery. Try not straightening your knee all the way out in that drive part when you're straightening your knee. Put a tiny bend in it. Second, watch your form. Make sure you're not doing extreme layback or messing when things are slouching or anything like that. Third, you can try a hamstring stretch. Fourth is a piriformis stretch. And last thing is a wonderful knee to chest or a double knee to chest stretch. Give those things a shot. If you've got questions, please feel free to reach out. You can row if you've had back surgery. Please don't let anyone tell you that you shouldn't be able to row. I help rowers get back to what they want to do, especially in rowing and back surgery. I help them get back all the time. I hope that helps. Please feel confident that you can row after back surgery. I've rowed after 3 ankle surgeries. So you can do it. And please let me know if you've got any questions.